For the next syndrome, which we'll be looking at, you know, oh, that's crazy. Oh, mad. Okay, so for the next syndrome, we should be looking at in chemical pathology is what is known as the AIS. So we're looking at this under the different abbreviations you can have in chemical pathology. Okay, so AIS, that's an autoimmune insulin syndrome. So what is it? So AIS, just so you know, is also known as Hirata's disease. So it's a rare cause of what? Spontaneous hypoglycemia. Like all of a sudden, the glucose levels in your body is dropping, is crashing down. So it's because the body is producing autoantibodies. That's like your immune system. It's producing things that are what breaking down insulin. Insulin has to be there to work on the food components to release glucose. So if anything is destroying insulin, yeah, there's nothing to work to release glucose. So you have low levels of glucose. That's the basis of this disease. So definition is an autoimmune disorder. That means what? Your body's immune system is attacking your body's components, which is the insulin now. So it causes unpredictable release and activity. Okay, it binds to insulin. So you can't really say when insulin will work now. Do you understand? Insulin activities is not straightforward again. It's very rare, but it's common in Japan. Okay, usually occurs in adults without prior insulin therapy, though a related condition known as the exogenous insulin autoimmune syndrome can occur in diabetics. So it's usually when there is what these are the subtypes, you can say mutations in that gene, medication too. So people taking drugs like all those metimazole, okay, that is used in treating hyperthyroidism, it can now tilt you into this issue. It's one of the side effects of the drug. So also if you have viral infection like Epstein-Barr virus, can also cause you this issue. And if you have other issues like systemic lupus erythematosus or Graves' disease, can also cause you this issue. Okay. So basis, your body is producing what? Autoantibodies that are attacking insulin. Okay. So the basis. Symptoms is what? You have all the symptoms that somebody will experience if their glucose level is low. Okay, sweating, tremors, weakness, palpitations. The person is confused, blood vision is not seeing well. Like when you're hungry now, normal thing, do you understand? Difficulties in concentrating. The person is hungry, is anxious, is weak. Okay, seizures, loss of consciousness. Okay, weight changes, insulin resistance. Okay, skin changes. So diagnosis from blood test. Okay, all those elevated insulin levels, you know, you must actually rule out insulinoma, which is a tumor. Okay, and imaging where pancreatic scans may be used to exclude tumors. Management include you tackle that hypoglycemia with what? Replacing glucose levels. Okay, all those glucose bolus, intravenous fluid. You must actually step up the glucose level of that person. Then stop any drug that is giving a side effect of that. Okay, then the person should be eating small, small, but frequently. Glucocorticoid or other immunosuppressants so that it will calm down your immune system to stop attacking the insulin. The plasmapheresis, this when if the antibodies are too much, that's the antibodies that are against insulin, if they are too much in the blood, they do some blood tests to actually what exchange your blood and clean it up to clean the antibodies out. So I think this is what we got. It's quite rare. Okay. It's a Japan issue.